It looks like everyone's in. Okay, so we are going to get started right away. We have lots of great information to go over. I am Dana Shive. I'm the Director of Communications and Membership Services. We have Sammie Davis with us today, who is going to be going over all things gender identity. A quick disclosure that I need to read for the one contact hour that everyone's going to get today. To obtain contact hours for this event, 100% of the activity must be attended, and you must submit an evaluation form. The link to the survey, the evaluation form, will be shared at the end of Sammie's presentation in the Zoom comments. I will also email that out to everyone tomorrow. No conflict of interest exists for anyone involved in the planning and implementation of this educational activity. And Pennsylvania State Nurses Association is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Centers Commission on Accreditation. So like I said, I will have the survey link in the chat at the end of the presentation. We'll also email it out tomorrow. And now I'm going to turn it over to Sammie. Thank you, Sammie, so much for being here today.
Yeah, thank you so much for having me. I see one familiar face on the Zoom screen, so it's so nice to be here and be with y'all today. So my name is Sammie Davis. My pronouns are she, her, hers. I am currently the Director of Student Success at Holy Family University in Northeast Philadelphia. Our population is about 51% nursing students at Holy Family. So I always feel very tied together with this kind of group. I'm coming from the Pennsylvania College of Technology prior to my current role, where I was the coordinator of diversity and student engagement, also a very high population of nursing students at Penn College. So in my prior role, I was in charge of doing a lot of different professional development for the Penn College students and staff and faculty about all different areas of identity. And now in my current role with student success, I do a lot on campus with how can we make sure that students are successful at Holy Family in their roles and getting everything they need out of their college experience. Also at Holy Family, I'm a member of the what we call JEDI Committee, Justice, Diversity, Equity, Inclusion. So that is a group on campus that looks at how are we making sure students are happy and healthy and being treated as equals on campus. And outside of my professional career, I am a part of NODA, which is a national organization for orientation, retention, and transition in higher education. And I'm on their Diversity, Equity, and Inclusion Committee as well. So this topic today is something that's really near and dear to my heart. We're talking about the LGBTQ community and healthcare. As I mentioned, it intersects with my day-to-day work a lot. So I'm very happy to be with you all today. And it is Pride Month. June is Pride Month. So it's a very timely time to have this conversation. So just kind of a quick outline of, what we're going to be talking about today in our 1 hour together. We're just going to start with a little bit about why are we here? We are going to be talking about gender identity as it was described, but that is a very cumbersome topic. There is a lot that goes into gender identity, and there's overlays when we're talking about gender identity. So we're going to, again, cover why are we here today, specifically talking about healthcare in the LGBT community. Then we're also going to go over some terms. So we're a little bit aware of when we say the word LGBTQ, what exactly does that mean for folks? We're going to hear some patient stories and offer some time for reflection. And then again, end with how you can help. I love to always end on that positive note of how we can bring that knowledge to the forefront. I'll add too that I know there's a large group of us here today. So if at any point you have questions, you can either throw them in the chat, raise your hand in Zoom, and we'll absolutely have time again for reflection. But I think the chat feature for Zoom is the great way to keep the conversation flowing. So please, anytime, throw a question or a comment in that box, and I'll make sure to get to it. So to, again, start with why are we here? So when we're talking about members of the LGBTQ community, and when I say LGBTQ, I mean lesbian, gay, bisexual, transgender, and queer folks, and that is, again, a big umbrella we'll talk about a little bit later. There are a lot of different challenges that LGBTQ folks might face when they're looking for the healthcare system. Commonly, people will face different microaggressions. A microaggression means it's a comment that subtly or not so subtly pokes at an identity that you hold. So a microaggression somebody might face in the LGBTQ community when talking about healthcare is, maybe a female is in the office and they say, "Oh, where's your husband?" Maybe they don't have a husband because they're a lesbian and they have a wife or a partner of a different gender identity. So those microaggressions happen when people are facing different systems. There may be overall harassment and discrimination that people face in terms of seeking medical treatment. So a lot of those can be a barrier to access for individuals. There are high rates of harassment for folks that make it hesitant to seek medical treatment, which can long-term lead to bigger problems. I'm sure you all know. If you feel like you have a cold and you're hesitant to go to the doctor for your cold, well, then that cold can turn into a bigger issue over the weeks that it's not being faced. There's a really interesting short documentary that the Sylvia Rivera Law Project puts out. It's called Toilet Training, all about transgender individuals and bathroom rights. And they, in that video, discuss how if somebody doesn't go to the bathroom, what health problems happen because of that. And it's just, again, a really interesting look at this small topic of, what bathroom can you use and how if you don't go to the bathroom, it leads to a big health problem. So again, day to day, people in the LGBTQ community might be facing, I'm hesitant to go to the doctor because of this issue, and it turns into a bigger issue down the road. The more you are aware of these common terms for the LGBTQ community, the better that you can be an ally and an advocate for your patients. That's why we're talking about this topic, and that's why I think it's really amazing that I was invited to speak today, because I think, again, whenever we can add tools to our tool belt when we're talking about different groups and identities, the better it's going to serve our patients in the long term. So really looking at the bottom bullet point, we're talking about what is our goal for today's session. Our goal is to learn some common terms, to help make sure that folks are feeling comfortable and confident using some terms when they're out with patients, building an awareness about issues facing the LGBTQ community, and then sharing experiences as healthcare professionals. As I said, we're going to hear some patient stories a little bit later, and it's going to offer some opportunity for reflection from the group. And I think, again, the more we can learn from each other and share together, the better it helps us overall when we go out into the world day to day. So I wanted to share some statistics with you all that I had found. This information is coming from the Center for American Progress. This is an organization that looks nonpartisan at people and how they can lobby for better treatment, equity of individuals based off of their different identities. So in 2017, the Centers for American Progress put out a survey focused specifically on discrimination for LGBTQ people accessing healthcare. And this was some information that survey found. So looking at people that identify as lesbian, gay, bisexual, or queer, respondents who have visited a doctor's office or healthcare provider in the last year before the survey, so that's about 2016, 8% of those respondents said that they had a doctor or a healthcare provider who refused to see them because of their actual or perceived sexual orientation. Now, sexual orientation, we're going to talk about more in depthly in about 2 slides, but that is talking about who is maybe your romantic partner, who are you physically attracted to, is your sexual orientation. So again, because of an actual orientation or perceived, those folks were not able to access healthcare. 6% said that a doctor or healthcare provider refused to give healthcare related to their actual or perceived sexual orientation. And then 9% said that a doctor or healthcare provider used harsh or abusive language when treating them. The numbers may seem low, saying 8%, 6%, 9%, those aren't double digits, which is great, but for 8% to getting refused treatment is not great, or 9% of individuals, having harsh language or abusive language used is not great. You know, I can think of people in my life who have shared stories with me of recently going to the doctor and the doctor making comments about their sexual orientation that made them very uncomfortable to the point where they said, I have to find a new doctor now. And that is an unfortunate occurrence that happens more often in the LGBTQ community. Now, the next bullet points are talking about transgender identity folks. So people in the transgender community who have visited the doctor or healthcare provider within the last year taking the survey, 29% said that a doctor or other healthcare provider refused to see them because of their actual or perceived gender identity. 23% said a doctor or other healthcare provider intentionally misgendered them or used the wrong name. Now, when we're talking about the transgender community, when you're misgendering a person purposefully, that can be really harmful to somebody. You know, in the transgender community, when a person is transitioning, they are saying this identity, you know, maybe being a female, being a woman is who I am. I really believe this is who I am. This is who I'm born to be. That is not, you know, my choice as an individual to say, no, you're wrong. You're not actually a woman. You know, that is the individuals, all of our rights to say, you know, who we are as people. So when somebody is intentionally misgendering somebody, that can do a lot of harm. You know, same thing with using the wrong name. If you're intentionally using someone's wrong name, it can be really harmful. I know it happens by accident. You know, we all make mistakes sometimes, and that's okay. You know, people in the transgender community, when they know you're trying and you're learning, you know, folks are very understanding, but that intentionality behind it is what can be very harmful to people. Again, I'll just share a quick story. In higher education, I had a student that came to my office one day after their first day of class and said, Sammie, I was in a Spanish class and my professor came up to me and in Spanish asked, are you a boy or a girl? And they said, after that, I can't go back to the classroom. I'm uncomfortable. You know, all the students heard it. And it can be very impactful. That was the first day of class. And that was that student's first impression of their professor. And to the point where they said, I can't go back there. So I think, again, when the more intentionality we have behind our actions and our language, the better we can assist people and be allies and advocates for others. And then lastly, the bullet point on here is 21% said doctors or other healthcare providers used harsh or abusive language when treating them. Again, I would never want anyone to feel like they were being harshly abused with language by anyone that they were seeking help from and seeking treatment from. And I'm sure you all wouldn't want that either. So again, why I bring this up is that awareness level. The more we can be aware of what's happening, I think the better we can learn and use that in our daily practice. So I just have some more information. Again, this was from a little bit more of a recent study, so I wanted to share it with you. This again is from the Center for American Progress. They did an overall state of the LGBT community study, but there was one section in particular that focused on healthcare, and that is where this information is coming from. So from 2020, the state of the LGBTQ community, there's more than 1 in 3 LGBTQ Americans that face discrimination or some kind in the past year, including more than 3 in 5 transgender Americans. So again, I think 3 in 5 transgender Americans is a very high number, and even 1 in 3 LGBTQ folks is still very high. Around 3 out of 10 LGBTQ Americans faced difficulties the last year accessing medical needs due to costs, including more than half of the transgender Americans. 15% of LGBTQ Americans report postponing or avoiding medical treatment due to discrimination, including nearly 3 in 10 transgender individuals. And then lastly, transgender individuals face unique obstacles accessing healthcare, including 1 in 3 who had to teach their doctor about transgender individuals in order to receive appropriate care. Now, I'm sure everyone in this call has been in a situation before where you maybe had to feel like you had to explain your identity or maybe teach something about yourself to another person. And it can be really difficult. So with transgender individuals, having to re-explain their identity or teach something about what kind of healthcare they need to others, again, it's that access, that barrier to access when we're talking about healthcare, that can be a challenge to individuals. So the more we can break down those barriers, the better we can treat our patients. So the next slides is when we're going to get into some of the meat and potatoes of terminology and what it all means. So again, if you have any questions or if I need to be more clear about something, please either, put it in the chat, raise your hand, and we'll make sure that it's clear. So I know I've used this term a lot, LGBTQ, it's an acronym. So LGBTQ is an acronym that really encompasses all different sexual orientations and gender identities. Those are two different pieces of a person's identity. So again, as you can see in this block up here, it shows that it's meant to encompass a whole bunch of different and diverse sexualities and genders. If you look, I'm going to focus on the left side of the screen here where it says LGB. That stands for lesbian, gay, and bisexual. So again, those are sexualities, sexual orientations a person holds. So who are you romantically attracted to? Who are you physically attracted to? That is what your sexual orientation is. Your gender identity over here, that is what the T stands for, is for transgender, also encompasses men and women. Your gender identity is how you identify your gender. So you can be a cisgender person, meaning that your gender, that your perceived gender matches up with how you identify. So for example, I identify as female. I was born female, I was assigned female at birth, and that's how I identify. So I am a cisgender woman. But if you're a transgender individual, that means that your sex assigned at birth does not match up with your gender identity. And then we have this queer umbrella, and that means it's representing that queer is an umbrella term that encompasses both sexualities and gender identities. Queer does not stand for one specific thing. People have reclaimed the term. I'm sure some of you on the call have remembered thinking that queer was a derogatory term and still is a derogatory term. It can be, but a lot of folks have reclaimed it and are using it to represent who they are and what their identity represents. I always give this disclaimer to folks that I would never identify somebody as queer unless they've identified that way to me first. Again, because of the derogatory nature of the term, I don't want somebody to feel like we are, again, using it inappropriately in identifying somebody. But if somebody says, hey, my name is Sammie and I identify as queer, awesome, great, good for you. And then that's how I would refer to that person from then forward. And then as you can see in this box at the bottom, Q also sometimes means questioning. We're all just trying to figure it out day to day. So you don't always have your identities figured out all the time. So maybe we're just questioning and trying to figure out where things go. Now, sometimes I get the question people ask, what is the right term to use? Is it LGBTQ, LGBT? Sometimes we add an IA and maybe a P on there. All are fine acronyms to use. It's really what kind of is most comfortable for you. For me, it feels most natural to say LGBTQ. So that's what I say day to day in life. But if you don't, that's perfectly fine. There are a lot of different identities, again, that are encompassed under this umbrella. So if you use different acronyms, it all falls under the same umbrella. So it is fine to use whatever you're most comfortable with. All right. So now we're going to look at one of my favorite little graphics. This is called the genderbread person. And this I like to shout out here. If you see right here, it says it's pronounced metrosexual.com. The genderbread person is coming from a person, his name is Sam Killerman. He created the genderbread person, and actually a longer, it's called Safe Zone training, going over all aspects of the LGBTQ community. But that website has really good information, really fun infographics. He also was interviewed by Katie Couric, I think for the Discovery Channel, and talked about gender identity. So I would just kind of a fun recommend Sam Killerman and that website if you're interested. But going back to the genderbread person, so this is a little infographic to describe the different aspects of identity and gender when we're talking about it. So it's, when we say gender, it means a lot of different things, and it's not a binary choice. You know, a lot of times we think male and female, there's women and there's men, and those are the two genders. And we categorize a lot of our lives into those two groups. You know, I walk down the kids aisle for my niece at Target, and there's blue clothes and there's pink clothes. There's blue shovels and there's pink shovels. You know, we kind of live in that binary world, but really it's a lot more mixed up than that. So I'm going to start at the top of the person and work my way down. So starting on the right here, it says identity, and it's pointing at the person's brain. So identity is how you in your head experience and define your gender based on how you align or how you do not align with what you understand options for gender to be. So as I said before, only you as an individual can decide what your gender is. For me, I identify as female, and that's how I live my life, but not everybody does, and that's okay. So again, the biggest thing is that it's an individual's decision of how they identify their gender. And then the heart, the next one down, it goes to attraction. So how you find yourself feeling drawn to or not drawn to some people in a sexual, romantic, or other ways. So again, it could be categorized by gender or not categorized within your gender, but your attraction is your sexual orientation. Down here at the bottom where it says sex, sex is the physical traits you are born with or develop that we think of as sex characteristics, as well as the sex you are assigned at birth. So what physical, body parts does a person have? And that goes along with their sex assigned at birth. So, think of those babies in the hospital. But again, your sex assigned at birth might not always line up with your gender identity for your whole life. And that's okay. Again, it's not a two-way street binary system. And then this last outline over here goes to expression. So gender expression is how you present your gender through your actions, your clothing, demeanor, a lot of different ways that we can express our gender. So for me, I have very long hair. I tried to scrunch it today. It rained, so it's a little flat right now. But, wearing my hair down, wearing a dress, wearing makeup, those are some ways that we typically think of as a female way of expressing your gender. But there could be other ways of expressing your gender that, again, could maybe go not within that female characteristics, or vice versa within male characteristics. So I want to point out too, this last little blurb over here at the bottom left corner, it says, we can think about all these things as existing on continuums, where a lot of people might see themselves existing somewhere between 0 and 100 on them. So on this next slide, you'll see those different continuums on the right. So for, again, gender identity, how you perceive your gender to be. This like little 0 slash mark, you can think of the 0 going all the way to 100. So maybe you see yourself 100% female, you're a woman, you really feel like you're a woman, you're set in stone about it. Awesome. Then you're all the way on the right here. Maybe not so much, maybe you feel pretty comfortable in your body and yourself, but you don't know if you're all the way 100%. That's totally fine too. Again, it's not a binary system. It can move back and forth. It can ebb and flow. Same thing for your gender expression. Something that we might think of as a very typical masculine identity is wearing a suit and tie to work. Maybe you're a female and you love wearing a suit and tie. That's awesome. Wear a suit and tie to work. That it doesn't bother anyone else. It's your clothes. So again, maybe you're not 100% on one side of the scale or the other in your gender expression. And then same thing here when we're going down here to who are you sexually attracted to and who are you romantically attracted to. So those do not have to be the same gender, the same person on either scale. I know sometimes people, maybe you're sexually attracted to men and you're romantically attracted to men, and you're the same on every scale. That's awesome, but again, not always. I had a coworker one time that said, they can only see themselves in a marriage and a long-term partnership with men, but they see themselves attracted to men and women. They just never really are in that long-term commitment with a woman. That's great. Again, it's a very fluid scales. If I always say, if there's one thing you take away from this page and this description, it's that fluidity. Not every identity people hold is 100% one thing all the time. There is, movement within our identities. As we get older, as we learn more things, it all might change. And I always like to point out too, you see over here too, again, when we're talking about the binary, we think about men and women, two different genders, but there is a very large population of intersex folks. Intersex community means that you were born with both male and female sex organs. I'm sure, again, you all are nurses. I'm sure you've come across intersex people many times in the healthcare system. Within the LGBT community, there is a pretty large population of intersex folks that sometimes that struggle because of that binary system. Sometimes they don't always know where to identify and where to find themselves. So I like to point that out and always recognize that, intersex individuals are a part of the LGBTQ community and should be recognized and spoken about too when we're talking about sex assigned at birth. Awesome. So I don't see anything in the chat right now with questions. I'll give it another second if anybody has a question or anything about this before I move on, because I know this part is a lot of information at one time. All right, perfect. So when we're talking about, gender and gender identity and what we can do day to day in this work, one of the biggest things I think that we can do day to day to represent is learning and talking about pronouns. So pronouns provide context to how an individual would like to be referred to, whether you're talking to that individual or whether you're talking about that individual later on. When I started this presentation, I said, my name is Sammie Davis and my pronouns are she, her, hers. So when you're talking about me later, you can say, Sammie's so great. We talked about this presentation and she's fabulous, because I know you're all going to say this is fabulous. And so you would use those she, her pronouns. The use of pronouns is often discussed in the context of the transgender community, but it really applies to everybody. And again, I like to stress that because all of us here in this room, we all have pronouns. We all are, identifying one way or the other. So yes, we're talking about being allies to the LGBTQ community, but really this information is relevant to every single person that's in this conversation today. So again, I just like to point that out and stress that to folks. We should always be using an individual's self-identified pronouns. We want to, stay away from assuming or guessing a person's pronouns based off of their gender expression. If they walked into our office and someone's wearing a dress, that might not mean that they identify as she, her, hers. So we want to try not to assume based off of gender expression. And if you aren't sure what someone's pronouns are, always ask. It's great to ask that question and to make sure you're being respectful. And sometimes the best way to ask is to role model it yourself first and have that person respond back to you. We spoke about this a little bit before about misgendering. Misgendering refers to how using an incorrect pronoun of an individual. It may be an accident. I know it accidentally happens to folks all the time, even myself. You know, I'm not perfect at this either. The impact can be harmful and long lasting for individuals. So again, when we make a mistake, we recognize we made a mistake and take it as a learning lesson to do better in the future. And I always like to stress this point too. You are going to make mistakes, and that's okay. We are learning and growing. Nobody is, perfect at this all the time, but we want to try our best to represent folks as we can. And this orange chart over here, I included this because it gives some examples of different pronouns. The gender binary, again, so those two different female and male, she, her, hers, he, him, his, those are pronouns that you may be familiar with. Some pronouns that you may be not as familiar with is someone using maybe they, them, theirs. Those are some more common gender neutral pronouns or gender inclusive pronouns, but there's also these other descriptors. Z here, here's, Z, zers, zers. Again, you may come across folks in your day-to-day life that use these different kind of pronouns, or you might not. Or there also could be pronouns not on this list that a person might like to use. The point is that we ask and we try to use them. So I have a question, and it asks, what's the appropriate way to ask the question? And that's really great. I think first off, I try to role model it myself. So I start conversations with, my name is Sammie, my pronouns are she, her, hers. Hopefully that person responds back. If they don't, you can always say, hey, I'm just want to be respectful. What are your pronouns? That's a great way to ask. Look if it's on any information. I'm thinking of like intake forms. I know my last healthcare provider, it's now included on all of intake forms for my healthcare system I personally use. So if there's any information like that you could look at, if maybe you felt uncomfortable asking, is it on their form? And you could, look in that way and be respectful. But I think the best way is always to just ask, hey, what pronouns do you use? I always say that you're either going to get two reactions. You're going to get the reaction of somebody saying, thank you for asking me, that I feel really included, or the person being like, he, she, what are you asking? What are you talking about? And in that case, you still know the answer, and you're still being respectful, but that it kind of went over their head. Those are usually the two answers I get. Either someone's like, thank you so much, or the other person's like, why are you asking me this question? That was a great question. So again, talking about pronouns in the workplace and in our day-to-day lives. Again, I've stressed this a few times, but we really want to try to role model that behavior. I think the more you do it, the more you're going to get comfortable with it too. Because sometimes it can feel really unnatural. Like, again, how I started the presentation using my pronouns. The first couple times I did it, it felt really weird, and especially when I was in a workplace situation where the other folks were not doing that. And it kind of felt like it felt just awkward. But the more I did it, I found the more other people started doing it too, to the point where I was in a meeting and everyone went around the table and started with their name and pronouns. And that was really awesome. So I think the more we can role model the behavior we'd like to see, whether it's pronouns or something else, the better it's going to be the outcome. You can start using your pronouns in different documents. Maybe it's in your email signature. I include my pronouns in my email signature. Maybe it's on your business cards. Maybe it's on your name tag that you wear. There's these other ways, these ways that we can include information that, again, are subtle hints that folks within the LGBTQ community or other folks who may be looking for those allies and identifiers, they're going to pick up on those messages, and it's going to make people feel more included. Introduce yourself in, again, groups, large gatherings, presentations, whatever it may be. Try avoiding using gendered phrases. So by gendered phrases, I have some examples on here. It's very common to walk into a room and say, oh, hey guys, how's it going? Or, oh, hey ladies, what's up? But that can be maybe off-putting to people who don't identify within those different groups. So I kind of default to like, hey y'all, how's it going? You know, whatever ways you can try to avoid binary phrases is helpful. And same thing with titles. I got that question one time, you know, maybe use the word firefighter instead of fireman. You know, any way that we can try to not gender a phrase is helpful for people. Whenever you're maybe questioning pronouns, I usually default to they, them, theirs. That's a great way to default, and then you're not using a binary in any way. And then you can always review different guidelines and policies that you have about, you know, is your, you know, department guidelines using gendered phrases? Are your intake forms using gendered phrases? If so, have a conversation about that. What could possibly be done about it? And then always be an active ally to the LGBTQ community. I think there's so many different ways that we can try to be allies and to be helpful to folks, again, in small, subtle ways or then in larger ways. Okay, so we have another question about pronouns I want to make sure we cover. So,
okay, that's me, Sammie.
Okay,
And
hi.
hi. And so, yeah, I have this question because we, you know, in other classes that I've taken, that word cis means that I was born female, I identify as female, but I'm also heterosexual. So I'm a cis female, correct? So I guess I just want to say, if they identify with that Z or her or zer, I don't know how to say those other ones. Do they put that in front of their identification like you do cis female?
Yep, so that's a great question. So the answer would be no, because your pronouns are just referring to how would you want someone to, you know, refer to you or about you. So if I'm saying, you know, I met Sammie today, she was nice, she talked about XYZ. So it's not saying, it's talking about your gender identity because you're saying this person identifies as female, but you're not saying she is a cisgender heterosexual person, if that makes sense.
Well, it does, but then where would I use the term Z and then her, zer, and I don't know how to say the ones with the X's.
Yep, so that would be if a person is using gender neutral pronouns. So those are just some examples of gender neutral pronouns someone could be using. So again, it could be, oh, I met Sammie today, Z was nice, Z talked about XYZ topic.
Okay.
So it's
All
the
right.
pronoun of like recognizing that individual.
Okay. All right. That helps. Thank you.
Perfect. No problem. Okay. So the next thing I'm going to do is I have a short video I want to share with you all. And this again, I'm going to stop sharing my screen so that I can go into the video. So this video is again talking about those stories. It is put on by a clinic in California, or no, it's not California, excuse me, in Chicago made this. And I thought it was really great because you get to hear from individuals about their lived experience. So it's under 5 minutes. I'm going to double check. My audio is shared. Perfect. So I'm going to watch this and then we'll discuss.
As a physician, I believe that my role in my patients' lives is to get to know them as people so that I can give them the best medical care possible.
As a member of the healthcare team, my commitment is providing the best healthcare that I can for our patients. Simple.
As a healthcare professional, I try to look at things holistically and really consider the entire person when thinking about what's going to help people get positive health outcomes.
I think it's really important to create trust and let patients know about confidentiality so that they are supported in being able to talk about their sexuality or people they have sex with.
As a person of color, I've always recognized that stigma is something that stands in the way of accessing a variety of services, healthcare included.
Stigma is one of those things that's always around us, but nobody really talks about it.
Stigma means almost like stereotyping, like seeing people, all people in a certain way and then treating them differently because they're different than you.
When I was a resident physician, I had a patient who was openly gay, and I could see that my senior resident basically made rude remarks about the patient in front of him. I made it a point to go back after our team had rounded to come out to that patient and also to apologize. I wanted my patient to know that, you know, basically not all people in healthcare were that way.
I go to the doctor and visit this institution where I'm incredibly vulnerable, because now my body is given over temporarily to these experts who are gatekeeping information to give to me about my own body.
So I remember going to my doctor and I asked her about just risk factors of, like, as being a queer woman, you know, what I should worry about or how can I keep myself safe. And she said, oh, you know, you don't need nothing to worry about. You're fine.
Our staff, if they're not trained properly, instead of asking people what pronouns they prefer to have used when we're addressing them, may automatically assume a pronoun is what the patient wants to use.
I experienced stigma in the healthcare setting after I had my hysterectomy. I was lying on the table and I heard one of the nurses refer to me as she. And I was a little groggy, but that was very, very clear. And she said it a second time. And the second time she said it, I said, I may have just had a hysterectomy, but I am a man.
A lot of it in the healthcare setting is our own stigmas. It's our own beliefs and values that we bring into the job that hold us back from providing the care for everyone.
I have to make some decisions for myself. Am I going to say, well, they have a certain impression of who I am and what that means, and the what that means is a really important piece, and now I have to figure out how to manage that.
I decided I deserve better.
I decided that I just didn't want to be another one of those people who turned away or didn't say anything, didn't speak up.
For me, it's important to be present in the room and to ask the questions that I need, even if they feel awkward to me.
I also decided to work with the institutions that I'm a part of to let them know where they needed to work to provide more unbiased healthcare.
I decided to speak up and tell my provider what I needed.
Members of the healthcare team can be heroes by asking questions, by treating people with dignity and respect, and making sure that everyone feels comfortable.
Patients can be heroes by speaking up when they feel that there's something that's not quite right about their health care.
I think the best thing to do is to just remember why you came there. Remember why you work in the healthcare field.
Do your homework and learn about the communities that you serve.
Don't assume something is a certain way just because it looks that way.
Affirming care leaves patients with a more positive impression and can lead to higher patient satisfaction scores.
We can do it.
We can do it.
We can transform our institutions to engage and retain all patients in affirming healthcare.
Together we can do it.
We can do it.
We can create a world where everyone can have their health needs met as a valuable individual.
Join us.
Awesome. So I'm going to flip back to the PowerPoint, but does anyone have any, thoughts from that video? Either you can, unmute yourself and share, or you can, share from putting it in the chat box. Also, can somebody confirm, do you see the PowerPoint right now? Perfect. Okay, great. Sorry, mine switched up. So what happens when I try to be creative? It messes up for me.
Sammie, just put it back in presentation mode.
I thought I did. Okay, perfect.
There we go. Perfect.
Thank you. All right. So any, thoughts or reflections, either again, put them in the chat box, or you can raise your hand that you wanted to share. I know for me, something that stands out watching that video, I really like it because you get to hear from the perspective from healthcare professionals, but also patients. When the individual said that, they're giving their body temporarily over to another person. I've never thought of it that way before about, seeking healthcare treatment, but I thought that was a really powerful, insightful way to say it. And very, very true. I know I've in my way, not as a member of the LGBTQ community, but just as an individual seeking healthcare treatment, had to put a lot of trust in other people for scary decisions that have to be made about your body. And it can be hard. It can be tough sometimes. So I thought that was a very insightful way to say it. Great. Well, I hope you enjoyed the video. Again, I think there was some good insights. It gave, I know, some really interesting statistics as well. So to just wrap up our conversation today, and talking about how you can help. So how can we take this information today and move it on into, an active role in our lives? So I think first and foremost, I always say, continue to educate yourself. When we say the LGBT community, this was a lot of information for a short amount of time. There is so much that we can continue to talk about. You can keep dissecting gender identity, you can keep dissecting sexual orientation, talk specifically about the transgender community. So the more research that you can do on your own and learning and growing, the better you're going to be equipped, again, with those tools in your tool belt to help your patients and to be an active ally and advocate to others. I always want to say, know your local, your state, your federal guidelines, who is making those decisions, how can your voice be heard? We all have different policies affecting our workplace every single day. So how do we make sure we know what that is, what those different policies are? And then again, how do we make sure we know how our voice is being heard if we think it's not being heard yet? And again, sorry, I'm going to interrupt my own point and say, that goes for our workplace too. So the third bullet point, know the policies of your workplace, what services are being provided, who to direct your coworkers and your patients to if more information is needed. So if maybe you talk to an LGBTQ patient and they're feeling maybe they didn't have the best service and they want to talk to somebody about that, do you know where to direct them at your workplace? If not, that's definitely something that you should look into. How we can help our LGBTQ folks have their voices be heard. Even our coworkers, I know today I referenced a lot the word patients, but I always like to say, whenever we're in these conversations, we're not just talking about the people we serve, we're talking about ourselves as well. So if you are feeling like you're not represented in your workplace, if you feel like you didn't get the best treatment, do you know where to seek that help and to seek that guidance from? Or your coworkers, how can you be an advocate and an ally to your coworkers? So again, it's not just who we serve, but how are we serving ourselves? Be a role model and for your behaviors and how you would like others to see. So again, you can't expect a behavior from somebody else if you're not doing the same thing. When I have employees that work for me, I always say, I would never ask you to do a job I wouldn't be doing myself. So really role modeling is pretty simple in that way. And then lastly, be an advocate and ally to your patients, to your coworkers, and yourself. Again, this information is not just for how we're serving others, but how are you using this for yourself as well? That is really important and key to the conversation. Okay, so again, I shared a lot of information and a little bit of time for all of you. So we have some time left. Does anybody have any questions that they feel like they would like more clarity on or has not been covered yet in the presentation? Again, you can unmute yourself or put it in the chat box, and we'll make sure that you get that, whatever information that you came here looking for today.
So I have another question. Sorry, I'm always full of questions. But so the question I have is that we had a friend, I had a friend who identified as gay and was going to their practitioner and wanted their partner to be a part of the conversation. But because they weren't legally married, the practitioner didn't allow that person, even though they had been a longtime partner, into the exam room, if you will. So I'm not sure. I don't know any state law that says something to, that doesn't say something to that effect. But I mean, this person was very upset about that because it was a conversation they sort of wanted the three to have. So how would you advise a person who had a similar situation?
That's a great question. I would advise that person to really look into the policies of that office. So if does that office allow partners of any kind, into an exam room, whether again, it could be a male and female partnership. If they're not allowed in the exam room unmarried, that might be that policy and that practice. If they are allowed into that exam room, again, that might be then the different conversation to be had. And maybe it's with the office manager of that place, or the higher level doctor of that practice, whatever it might be. But that's what I always start with, is kind of what's that policy? And if it's not a policy, then where's that practice coming from? Awesome, great question, Betsy.
Thank you.
You're welcome. And then,
Yes, Sammie, we have a question in the chat from Mary. I am a nurse practitioner. However, I am a grandmother of Jack. He is transgender. I am seeking information of the LGBTQ community. This was very informative.
good. Yep, so that is awesome.
So Sammie, do you have any suggestions on, maybe groups for Mary or communities that she could be a part of?
Yeah, so I would say, Mary, and for everyone on the call, I know in the state of Pennsylvania, there is a lot of different information online. If you Google like LGBTQ in Pennsylvania, there is some specific websites that the state has. There is some specific different groups that the state has that might provide you information about the state. But then again, for more just general information, I'll throw out there again, Sam Killerman and that website, it's called itspronouncedmetrosexual.com, has a lot of really fabulous information about gender, but then also about a lot of different topics about identity. When we're talking about, race, we're talking about equity and inclusion. There's a lot of really helpful information in there. So I'm going to type it in the chat right now, so the website link can go out to everybody.
Sammie, is that Kellerman, K-E-L-L, or Killerman, K-I-L-L?
Kellerman.
Thank you.
Okay. So it's pronounced metrosexual.com. All right, I think I spelled it okay. Yes, and I saw someone else put this, the transstudent.org. It is definitely a really great resource for trans youth and their families. I've actually used some of that information in the past. They have a really informative infographic about transgender youth and homelessness that I've used at previous programs. So thank you, Shaylin, for throwing that in the chat as well. So I would just say, when you're interested in these topics, Google is always your friend. I think that there's a lot of, again, each part of our identities, we can go in different wormholes about and finding information. So I always say, start with your state. What does your state offer? What does your county offer? What is then your local community offer? And then branch off of that, is there any, podcasts or books that you really like that you can find and go from there? I can tell you too, so Sam Killerman, I think, sorry, I'm in my office and I'm wheeling back because there's this really awesome book. It's called A Guide to Gender that is put on by Sam Killerman, and that you can buy it on the itspronouncedmetrosexual.com website. So A Guide to Gender, very good, very informative book. And it's fun too. It has lots of pictures and fun infographics. So it's always better to read fun books. All right, great. So I love that people are commenting in the chat. Yes, it will be recorded, the presentation. Any other questions or comments before we, leave our group?
Sammie, I just want to say thank you so much. This is Dana. This was amazing information, and I feel so helpful to all of us on the call. So thank you so much for spending this hour with us today.
Yeah, absolutely. I'm so happy to. Again, I have this, the last screen up here is my email, my contact information is the best way to connect with me. You can also on LinkedIn connect with me in that way too. You know, I'm so happy to, again, talk about this topic, be an ally to this topic. It's a passion of mine in the work that I do in serving students in higher education. But again, I think in our daily lives, our daily practices, we can use this information as well. So thank you for being here today. I'll hang out for the next 3 minutes for anyone else that might have questions or need anything. But, you know, please feel free to reach out if you have anything, and happy Pride Month.
Yeah. Thanks, Sammie. Bye, everyone. Have a good rest of the day.
Thank you.
Bye, everyone.
Sammie, I had
Sammie, thank you so much.
Sorry, Wayne.
No, it's okay. It's good to see you again, Sammie.
It's so good to see you, Wayne. Thanks for asking me and having me.
Sure. I didn't want to jump in front of anyone if anyone has questions.
I gotta head off, but I just want to say it was a wonderful presentation. Thank you so much, Sammie. I worked a lot at Penn State with our Gender and Identity Resource Center, and it's like just the most amazing services offered for students, and just really spreading that narrative and changing it around. So, you know, we're all more comfortable in our own shoes in society. So thank you so much.
Good. Thanks, Tom, so much for being here.
Yep.
Have a good one.
Same to you. Bye all.
Sammie, this is why I had to keep turning off my video right here. I have a sick little babe at home today.
I totally understand. That happens with, I have a 2-year-old niece. Some days I work from home and that happens too.
Yep. Mm-hmm. All right, well, I think we'll hop off. Does anyone have any other questions?
Sammie, I just want to tell you, I'm Denise. I'm listed under my son's name. So I'm using his computer, but I never met you before. Work at Holy Family. So, and I think you and I we need to connect.
Yes. Yep. I am out for vacation next week as well. So let's connect maybe the phone when we both get back on vacation.
Okay, that sounds good. I just want to make sure I'm not overstepping boundaries. I don't really get much guidance with what's allowed and what's not allowed. And you know, I think my particular topic that I teach there, this comes up a lot.
Yeah, absolutely. No, I'd love to talk more. I'm so happy. I was wondering, I'm like, I didn't say it to anyone in the School of Nursing or anything. I was like, I wonder if anyone's going to show up from Holy Family. So
yeah,
it was fun. So yeah, send me an email and we'll chat.
Excellent. All right. Thanks for your time.
Thank you.
Bye.
Sammie, do you mind if I share your contact information in the email that I send out with the recording everything, just in case they don't get all the way to the last slide of the recording?
Yep. Yeah, no, that's totally fine for sure.
Okay, great. Well, thank you so much. We can end this.
You forgot.
Just hold on. We can end right now, but I'll be in touch. And thank you so much, Sammie. I really appreciate it.
Yeah, thanks, Dana, so much.
Have a good rest of the day.
Good. Tell Wayne I said hi again. It was good to see him.
Okay, I will.
Bye.
See you, Sammie. Thank you.